The Pounce system has really changed my approach to treating limb ischemia because it allows me to treat in mostly a more timely fashion. I really like the fact that I can get through an endovascular case pretty efficiently with thrombotic debris being removed in minutes, and in doing so, it takes away the need for thrombolysis and an ICU stay pretty routinely. And then I can also use it in debris states where it's more atherothrombotic and it's not necessarily a fresh embolized clot, but it's something that's been a little bit more chronic, and I can extirpate matter without having to worry about embolization as much, because I can kind of clear the pathway and then go on with the rest of my treatments pretty efficiently. What are your thoughts?
I would say the same. I think efficiency and a decrease in uncertainty is a way that I would describe it. Again, if the inciting pathology, be it thrombus, be it acute on chronic thrombosis, is at a level where this device can be used based on diameter of the vessels, then I'm pretty confident that at the end of the procedure, I'll have a degree of technical success that is satisfactory to me and to the patient, leading to improved outcomes, decreased use of adjuvant therapy like TPA or ICU stays, and can lead to kind of what we would expect more from a lower extremity intervention, which is that the patient recovers well, usually goes home in an efficient manner, and has a prolonged satisfactory outcome, and leading to limb salvage.